Thank you. At the outset, can I thank the Mental Health Reform and Dr. Philip Hyland of Maynooth University for their assistance in drafting this particular motion. And Las Cancorla, I know it's something that you'll join me in, and that is I want to thank the mental health staff who are working in hugely trying circumstances in our services across the country, and particularly in our acute services, something that's close to, I know, your own heart as it is my heart. Las Cancorla, I want to raise two specific issues. And the first one is in relation to young adults, because I think they've been disproportionately impacted by the restrictions that have been put in place in terms of COVID-19, particularly from a mental health perspective. And yes, look, there has been a lot of focus on older people and isolation. And yes, there are challenges in isolation in urban areas and rural areas. But for young people, their lives have been turned upside down. These are people who this time last year would be going out, would be in college, would be involved in clubs and societies, would be involved in sporting organisations. All of that is gone. They're not even attending lectures at the moment. They're not having that basic human interaction that is so normal for young adults. And I'm really frustrated that we're brushing this issue under the carpet. Now, Minister, you know on a number of occasions I've brought this issue directly to the attention of Taoiseach, that we need to look forensically at the restrictions that we put in place and look at the risks and balance up those risks with the benefits. And that is not happening because we're ignoring the vast volume of data that is there and make decisions. And yes, it may be that we say to young people that yes, you can meet in a coffee shop, you can go back to lectures. But if you do that, then you need to isolate before you visit granny or granddad or keep away from older people. Because the risks with younger people are far less once they remain within their own bubble and cohort of the population. The concern is that they would bring that virus back into their own family settings and, as a result of that, spread that infection to older people in particular. But really, we need to be far more forensic in how we're dealing with it. You know, if we believe that it's vital that children should have access to education at primary and post-primary level, surely the same applies in relation to our third level students. And while I mentioned the issue of children, Minister, you know, we have a very serious backlog in terms of our mental health and behavioural health issues in CAMHS across this country. 2,229 children purely on a waiting list for assessment, never mind getting the treatment they require. The final issue I want to raise with you, Minister, and that is in terms of the mental health services across Roscommon, Galway and Mayo. I'm astounded to find out, as part of the winter initiative this year, dealing with the consequences of COVID-19, not one additional cent has been provided to our mental health services. Now, we have been told that the mental health services should be under Sláinte Care, we should be having 10% of the total health budget. Last year, the mental health services had 6% of the total health budget. This year, it has been cut to 5% of the total health budget. Now, the reality is that more and more pressure has been put on our mental health services, and particularly in relation to our acute mental health services in the West of Ireland. We're looking in our acute units in the West of Ireland at 100% occupancy. And in terms of the COVID-19 standards, we should, at a very maximum, be operating at an 80% capacity. But people are being turned away. And not only are they being turned away, but they're being turned away and there isn't an alternative service available to them. because the mental health support networks and support services that should be in place have been wound down because of social distancing. And that is compounding the issue of isolation, particularly for people in an acute phase of their mental health issues. And this will have, I'm afraid, Minister, long and far-reaching consequences unless it is addressed and addressed immediately.